I'm sitting here at Skin Maison. I'm about to do PDGF, which is like PRP and PRF, but it's way stronger. I did PRP before, so I'm going to compare the two experiences.
Essentially, PRP, which is platelet-rich plasma, is whenever you draw someone's blood, spin it in a centrifuge, which separates it into two categories. Your growth factor, which is the yellow component, and the rest. We take the growth factor and we inject that into the body to help heal. PDGF is a man-made or a lab-grown growth factor system. The difference is there's only one type of growth factor in the PDGF, where compared to your PRP, there's multiple different types of growth factor.
This is supposed to be way more effective, and you only have to do it like once or twice. So this is the REScence PDGF. So PDGF stands for platelet-derived growth factors. The PRP was like a 9 out of 10, and this was like a 4 out of 10. Like you can feel like a little pinch, but it does not burn anything like the PRP.
The reason why PRP is more painful is because there's an anticoagulant separator in the tube. And that anticoagulant separator is acidic, which means your pH level is a little lower, which will burn. However, you can neutralize the pain by adding sodium bicarbonate to it, which is a basic product, and therefore you're now making it pH neutral.
The one with the cannula, obviously, so that's why there's a little bruising. I'm a little swollen, and it definitely feels a little tender.
So a cannula is a needle. Essentially, this is a needle where you have a sharp tip. We make a poke into the skin to break through the skin, but then we change it to another type of needle that is blunted with a hole on top right here. And this cannula bumps veins and vessels out of the way, making sure that we don't bruise them or bruise them a lot less compared to using a needle alone.
Quick update, I'm just a little bit swollen, but it already looks better. So I'll give you guys an update in like a week.
The duration of inflammation can last anywhere from 1 to 3 days. She also mentions this potentially could be a one-time thing. Unfortunately, we're always aging, so this is definitely not a one-time thing. You'll have to do this regularly. Fun fact, PDGF is not Health Canada approved, and in the States, it's still used off-label. It's definitely not a one-time use. You're going to have to do this for a series of 3 sessions, and then after that, you're going to have to maintain it once every 6 to 12 months. But again, it's experimental.